Dr. Peter Glidden here, your steadfast advocate for health. Thanks so much for your time. As many of you are aware, I was featured in a YouTube video that went viral, over 82 million views, which talked about the ineffectiveness of chemotherapy for cancer treatment, and it also talked about the effectiveness of the trace mineral selenium in the prevention and the treatment of cancer. I'd like to follow up on that video with information, because I've gotten nothing but flack from my medical colleagues. Snopes gave this information 2 thumbs down, which led me to believe what is going on here. This is academic. This is not some one doctor's opinion. These are academic facts which the population at large is unaware of and the media is unwilling to support. I'm wondering if the huge pharmaceutical revenue that the media secures every day, week, month, and year has anything to do with their bias. They should be ashamed of themselves. You're welcome to your own opinion, but you most certainly are not welcome to your own set of facts. I'm going to lay the facts out for you now, and I'm going to do it with half of my brain tied behind my back so my MD colleagues have a chance of keeping up. Thanks, Rush. Cancer by the numbers. According to the Center for Disease Control and the American Cancer Society in 2016, approximately 1,685,000 new cases of cancer, approximately 600,000 deaths. You know what that translated to? 4,620 new cases of cancer each day, 1,630 deaths from cancer each day. It's not any better in 2020. Projected numbers are 1.9 million new cases of cancer. And look, even if you make an adjustment for population growth here, you can see that the incidence has flatlined, more or less, maybe gotten a little bit better. But that's because of stopping cigarettes and asbestos remediation and things like that. By and large, conventional medical doctors have no idea what causes cancer. They have no idea how to treat it. And while we have given ourselves over to their exclusive control, treatment, the war on cancer has been lost. It has been lost. Unless, of course, you believe the National Institutes of Health data. Like the fella said, there are lies, damn lies, and statistics. If you go to the National Cancer Institute's SEER website, which is an acronym for Surveillance, Epidemiology, and End Results Program. This is the gold standard of, the statistical overview of the effectiveness of cancer treatment. You're going to get a completely misleading picture. Type in breast cancer, and here's what you see. Oh my God, 89.7% of women who got breast cancer survived breast cancer. Holy smokes. Let's give them the benefit of the doubt, 90%. That seems like we've won the war on breast cancer, doesn't it? Well, yeah, except this isn't cancer survivorship. Number one, it's 5-year cancer survivorship. The treatment outcomes for cancer are so poor that the American Cancer Society and the Center for Disease Control years ago stopped even considering the notion of a cure. Instead, they couch all of their statistical outcomes inside of this 5-year survivorship window. What does that mean? Well, if you are diagnosed with cancer and you are still alive 5 years and 1 day later, even if the cancer has come back, that goes into the record books as a successful treatment. The books have been cooked, but that misdirection pales in comparison to the relative survival statistic. This number, 89% survivorship after 5 years, is not an absolute survivorship. It's a relative survivorship, which means they take the number of women who died from breast cancer, and then they look at the number of women in the same demographic in the general population who died from other things. They do some subtraction and they come up with a new number. It's a relative survival index. And let's be honest, most people have no idea what that means. They have absolutely no idea what that means. And they think that, well, this is This is a professional website. This is the Center for Disease Control, for goodness sakes. They must not be misleading me. This must be accurate and true. It must be a 90% survivorship. Well, no, it's not. Let me line that up for you. Let's say we have a mythical kingdom, and in this mythical kingdom, there are 1,000 people who get cancer. And let's say it's breast cancer. And 900 of those 1,000 die, and 100 live. This means that there is a 90% absolute death rate, right? 90% absolute death rate, which means a 10% absolute survival rate. Those are the real numbers that you should be given. However, when we're talking about relative survival statistics, we then go into the general population and we look at people in the same demographic, right? The same age, the same sex, the same socioeconomic strata, and we look at how many of them died from other things, like, car accidents, heart disease, high blood pressure, opioid overdose, heroin overdose, whatever. And we add those numbers into the mix. So if in our fictional kingdom, 80% of women in the same demographic as the women who got and died from breast cancer, if 80% of those women die from other things, the relative death rate then becomes 10%. 90% of the absolute death rate minus 80% of the general population dying from other things. That leads to a 10% relative death rate, which translates, of course, into a 90% survival rate, relatively speaking. So with a statistical stroke of a pen, we have magically transformed a 90% death rate into a 90% survival rate, and that's how you have been misled. There ought to be a law against such grievous misdirection. You have been played. You don't believe me? Well, let's dig a little deeper on the same website. When we look at the National Cancer Institute Surveillance Epidemiology and End Results Program, absolutely, the numbers of people who got breast cancer and the number of people who died from breast cancer, here are the numbers. Let's compare 1975 to 2014. Well, numbers in 1975, the population 216 million. Population in 2014, 318,900,000. You can read the numbers here. Here are the percentages. In 1975, 10% of the population got breast cancer. 3.1% died from it. 29 years later, 13% got breast cancer and 5.9% died from it. Does that mean breast cancer numbers are getting better or they're getting worse? They're getting worse. So how can these two things be the same? I mean, they're on the same website. It's because the numbers at top in the green are the relative survival statistics. You have to dig for the absolute survival statistics, and since nobody does, you're misled, you're misdirected. And again, there ought to be a law. Now, sadly, this just doesn't apply to breast cancer. Let's look at small cell lung cancer survival rate over 5 years. See that number 4? The numbers here represent the percentage of patients still alive after 5 years. After 5 years. So if you have small cell lung cancer, 4%, if you're treated at the Cancer Treatment Centers of America, are going to be alive, which means 96% of people with this type of cancer will die. Ovarian cancer, 33% will be alive, which means 67% will be dead. And if we go to 6, 7, 8, 9, or 10 years, everybody's dead. Pancreatic cancer, forget it. 98% of people are dead after 5 years. Prostate cancer, 69% of people are dead after 5 years. Rectal cancer, 91% death rate. Stomach cancer, 98% death rate. Colon cancer, 93% death rate. Throat cancer, 100% death rate from throat cancer after 5 years. You've got to be kidding me. Now, you don't have to be a statistical genius to understand all this. It's easy to be misled and misdirected. It's very easy to be misled and misdirected. But really, you just have to bring street smarts into the equation here. So, ask yourself this question. How many people in your, sphere of reference, in your world, not like celebrities that you've read about, but how many people in your family, your workplace, your church, your golf club, whatever, how many people do you know that have had cancer? How many of them are still alive? And has it been more than 5 years? If it's been more than 5 years, how is the quality of their lives? Just ask yourself these questions, and when you start doing the calculations, you will be horrified. Conventional treatment for cancer is an abject failure. And it persists because of the medical monopoly which has been in place since 1912. And who amongst us is not compassionate? Everybody's compassionate, right? So our heart goes out to cancer victims, especially kids who have cancer. And yeah, we're going to give $100 to come up with a cure for cancer, but it's too bad we're giving it to the profession under whose tutelage these kids got cancer in the first place, and the treatments fail, for goodness sakes. We shave our heads to be in solidarity with the people who have gotten cancer, and we bow down, genuflect at the altar of technological medicine, and we put all our money, we place all of our bets on that horse. And that horse has consistently let us down. And the socialization is so complete here that when we talk about people who have died from cancer, it's always talked about inside of the context as that person put up a valiant fight for cancer. They put up a valiant fight for cancer. It's never talked about, son of a gun, that person got cancer while they were under the treatment of and care and tutelage of the MD, and the MD's treatment failed. And into the bargain, the treatment created massive side effects, ruined the quality of their lives, and sent them into or close to bankruptcy. We never talk about it like that. It's always the valiant fight of the patient. It's never the failure or the profiteering of the conventional medical system. We rattle our chemo bottles to celebrate our health. And talking about chemotherapy, let's take a look at the history. You want to put a seatbelt on. Chemotherapy was developed in World War II as a derivative of mustard gas in Bari, Italy. Soldiers exposed to mustard gas had reduced white cell counts. In 1943, Goodwin and Gilman, doctors from Yale, used it to treat non-Hodgkin's lymphoma. So they used a derivative of mustard gas, right, which was the original chemotherapy recipe, to treat non-Hodgkin's lymphoma. So if chemotherapy was so effective at treating non-Hodgkin's lymphoma, then why is non-Hodgkin's lymphoma still a big deal today? Because it's ineffective. It doesn't work. Not only does it not work, the side effects are unbelievable. This from the National Cancer Survivorship Initiative. 500,000 people in the United Kingdom are facing poor health or disability after treatment for cancer. 350,000 people living with and beyond cancer are experiencing chronic fatigue. 350,000 are having sexual difficulties. 240,000 are living with mental health problems. 200,000 are living with moderate to severe pain. 150,000 are affected by urinary problems such as incontinence, and et cetera, et cetera, et cetera. Well, not only does it not work, but it creates massive side effects into the bargain, and it is unbelievably expensive. And by the way, did you know that chemotherapy drugs are the only drugs that the prescribing MD gets a direct percentage of? Did you know that? You know, if your medical doctor prescribes a blood pressure medicine, right, there's no kickback. You get it from the pharmacy. You know, if that doctor makes 10,000 prescriptions in 1 month, Pfizer Pharmaceutical or whoever makes that drug might give him a trip to a medical conference on Oahu. But there's no immediate kickback. With chemotherapy, there is. Here's kind of how it goes. The hospital buys the drug for $2,000. They sell it to the patient for $10,000. And the oncologist and the hospital split the difference. Chemotherapy drugs are the only class of pharmaceuticals that the prescribing doctor gets direct compensation from the prescription of. And there ought to be a law. By the way, this type of ineffective, expensive treatment are driving world economies into the dust. Total cancer expenditure in 2010, this was, I believe, was this in Great Britain? No, this was NBC Nightly News with Brian Williams. It's a lot of money. The medical industry profits, and the expenditure for cancer in 2020, the projections are $157 billion. That means the medical industry is going to profit $157 billion in the ineffective, mediocre, expensive treatment for cancer. And I'm the quack. And here's the article that started it all off. This is the article that I was talking about in my YouTube video. This was published in 2004. The Journal of Clinical Oncology. The debate on the funding and availability of cytotoxic drugs raises questions about the contribution of curative chemotherapy to survival in adult cancer patients. So these doctors from Australia said, you know what? This cancer treatment is bankrupting us. We need to take a serious scientific look to see whether or not it's working and it's worth it or not. Here were their results. Published. This was 14 years ago. The overall contribution of curative cytotoxic chemotherapy to 5-year survival in adults was estimated to be 2.3% in Australia and 2.1% in the United States of America. As the 5-year relative survival rate for cancer in Australia is now over 60%, it is clear that cytotoxic chemo only makes a minor contribution to cancer survival. So chemotherapy should be abandoned. This is what they said 14 years ago. Do you think that chemotherapy prescriptions have increased or decreased since then? All you have to do is follow the money and understand who is prescribing this stuff. It's not the naturopaths that are doing it. It's not the Ayurvedic practitioners, not the acupuncturists, not the homeopaths, not the herbalists, not the chiropractors. It's the MDs. And keep in mind, your medical doctor may be the nicest person God ever created, but your medical doctor doesn't practice medicine. They practice allopathic medicine. By definition, allopathic medicine is oppositionally defiant. Allopathic medical doctors are taught to orchestrate a violent takeover of the human body with drugs and surgery. That's how the drugs got their names. Antibiotics, anti-inflammatories, antacids, right? Serotonin reuptake inhibitors, and so forth. Allopathic treatment of cancer attempts to kill the tumor. The tumor is not the disease. It is the result of the disease. Therefore, when you kill the tumor, right, where you dissolve the tumor with chemotherapy, you remove it surgically or you burn it with radiation. Without removing the cause, it comes back. And this is the problem with cancer. Conventional medical treatment may be successful initially at eliminating or reducing the tumor, but it always comes back. Because the medical doctors giving cancer treatment are bringing the wrong medical philosophy to bear on the treatment of cancer. They're treating the tumor. The tumor is not the disease. It's the result of the disease. But because they're in complete, utter, and total control over the development and the delivery of medicine in the monopolized medical marketplace, whatever they say goes, even if it bankrupts you, even if it doesn't work. This is the problem with a lack of a free medical market. Let's review. We don't have a free medical market. We haven't had a free medical market since 1912. The only branch of medicine that cancer research and treatment goes to is the MDs practicing allopathic medicine. Allopathic medicine of cancer delivers statistically horrible results with horrible side effects at a huge profit to the industry with a high incidence of recurrence. Period. It doesn't work. It should be abandoned. Caveat emptor. Now, here are my recommendations. If you, heaven forbid, or someone in your life you know is diagnosed with cancer, they need to ask their oncologist these 10 questions in the presence of a witness with a recording device. And I am as serious as a heart attack. If you can get an oncologist to answer these 10 questions authentically and honestly, you most probably will not engage that cancer treatment. Remember, this is just an honest Q&A with your healthcare provider. Doctor, what caused my cancer? The doctor's not going to know. They're going to say genetics. Really, doctor, what gene? On which chromosome is it? Will your treatment cure my cancer? The answer is always going to be no. If it will not cure it, what can I expect it to do? What side effects will the treatment engender? How will you treat the side effects? Can the treatment that you're recommending cause cancer? There's a good question. What percentage of people who get this treatment get cancer from the treatment? How much money will you make from this treatment that isn't going to cure my cancer, that might give me cancer, and that's going to produce massive side effects? I want to know, how much money are you specifically going to profit? Look, I'm in favor of, making money, and I'm a businessman, but I'm shopping for the best care here. So I need to know how much money you're going to profit versus how much money medical doctor B down the street is going to profit. I need to know these numbers. Let me know, please. It's not a criticism. I'm just collecting data. How much money will this hospital make from my treatment that isn't going to cure my cancer? And I'd like, lastly, for you please to give me the names of 5 patients whom you have treated that have the same type of cancer, and I'd like to contact them to see what their quality of life has been. But only if they've survived 5 years or more. Now, if you ask those questions and you're not thrown out of your oncologist's office, I'll be very surprised. But these are the facts, ladies and gentlemen, before the board. Remember, you are being misdirected and misled. You don't really have an academic understanding of the differences between different types of statistical analyses, relative analysis versus absolute analysis. You don't know these things. It's easy for you to be misled. So the Zen sword to cut through all of this misdirection are these 10 questions. I encourage you to ask them honestly with an open heart, a witness, and a recording device before you attempt to engage conventional medical treatment for cancer. I am your steadfast advocate for health, Dr. Peter Glidden. If you've liked this information, you're going to love the rest of the information that's available on my website. Here are my social media details. Please follow me on Facebook, like me on Facebook, subscribe to my YouTube channel, and follow me on Twitter. A rising tide lifts all boats, and we must stick together to disseminate this information to everybody wise enough to hear. God willing and the creek don't rise, I will see you next time.